Modern life. Between careers, kids, and health, it can be mayhem. That's why we're here. I'm Dr. Lisa Varghese-Kroll.
And I'm Dr. Lonray Falusi. We're physicians, moms, and longtime friends who break it all down for you. Wondering how to juggle all the balls and still stay sane? Looking for advice but don't want to be overwhelmed?
Curious about how to make the most out of life for your family but enjoy it at the same time? You're in the right place. Welcome to Health and Home with the Hippocratic hosts.
On this episode, we're separating the headlines from the actual science. Does taking Tylenol during pregnancy cause autism? Spoiler alert, there's a huge study that's going to make a lot of worried parents feel better. Plus, we're talking about an emerging treatment called Leucovorin that's showing real promise for some kids on the autism spectrum. Whether you're pregnant, have a child with autism, or just want to understand the latest research, this one's for you.
Hey everyone, welcome back. Hi Lise.
Hey Lon! Hey everyone!
All right, so we've been on hiatus for a bit, catching up on life.
Right? But we missed you all and we could not stay away much longer.
Indeed.
And can I just say, it is so good to sit down with you and have an adult conversation after the morning I've had.
What happened?
Lonray, my preteen informed me that 6-7 is on its way out.
Gosh.
And no, it did not and still does not mean anything. Okay? It did not mean anything then and it does not mean anything now, and yet somehow it is going out. My brain is short-circuiting.
It cannot leave any faster as far as I'm concerned.
Totally agree.
It can 6-7 its way out of here. Yeah, no, the preteen years are truly just magical. My 10-year-old told me yesterday that my fashion sense is cringe, just so cringe, Mom. Because apparently only Gen Alpha knows how to dress, even though their baggy pants are straight out of our wardrobes from the 1990s.
Yes! Those kids, they're total thieves. Brazen thieves. And then they have the audacity to look down on us. All right. Well, today, we're actually going to talk about something a lot more important than our questionable parenting reviews. We are diving into some recent autism news that's been making waves.
Yes. And I know that this is a topic that touches so many families. In my practice, I have quite a few patients on the autism spectrum. So I field a ton of questions from worried parents about, autism risk factors, new treatments, all of it.
Right. So today we're going to break down two big topics: the ongoing conversation about acetaminophen, that's Tylenol, and autism risk, and then some really interesting emerging research on a treatment called Leucovorin.
So we're going to keep it science-based, but actually understandable because, medical journal language is, let's say, not designed for 9 p.m. parenting panic Googling.
Panic Googling, the defining characteristic of our generation.
Yeah,
Take
right.
that, kids. All right, let's jump in.
All right, so first, let's just set the stage a little. So the most recent CDC data tells us that about 1 in 36 children are diagnosed with autism spectrum disorder. That's up from 1 in 44 just a couple of years ago.
And that increase, it's important to say this, is largely due to better recognition and diagnosis. It's not necessarily a true increase in cases. We're getting better collectively at identifying autism, especially in girls and in kids who might have been missed before.
Yep, exactly. And I see this in my practice. So we're screening and catching kids earlier. We are recognizing that autism presents really differently from child to child. There's no, one set definition of what every child looks like who has autism. Some kids have significant language delays. Some are verbal, but maybe struggle with social communication. Some have sensory sensitivities that really impact their daily life, and some don't.
Right. And as a pediatrician, you see every day that it's truly a spectrum.
It really is. It really is. And when parents get that diagnosis, or even when they're in that, scary, in-between space of wondering and waiting for evaluations, the questions just flood in, what caused this? Could I have prevented it? What do I do now? Is there any treatment?
And
What
those
does it
are
mean for my
all
child's future?
right. I mean, they're completely valid questions, right? The hard part is that autism is complex. And even though we in the medical community often use words like disorder to describe autism, we do want to be careful and recognize that every child and every family's experience is different.
Right. And the last thing that we ever want to do between the two of us, right? The last thing we ever want to do is to be ableist and add
Right.
more stigma to this condition. Words really do matter.
For sure. And autism is not one thing with one cause. We know that, for example, genetics play a huge role. Probably 60 to 90% of the risk is genetic.
Right. And then there are those environmental factors too. And that's where things get really muddy and where a lot of anxiety lives for parents. So that brings us to our first topic today.
Right. So, acetaminophen and autism. Okay, Lonray, I know you've been getting questions about this. So what are parents asking?
So here's what the questions are based on. Over the last few years, there have been multiple studies suggesting a link between acetaminophen use during pregnancy or early childhood and increased autism risk. And understandably, parents are freaking out.
And it breaks our heart. I mean, that's
Exactly.
awful.
Right. So let's break down, though, what the research actually shows. So there have been several large studies, we're talking tens of thousands of participants, that found some associations between prenatal acetaminophen exposure and slightly higher rates of autism and ADHD diagnoses later in childhood.
And when you say association, you mean?
I mean correlation, not necessarily causation. And this is so important. So these are observational studies, meaning that they track a person or a population over time. And they can show that two things happen together, but they can't prove that one causes the other.
Right. In the same way that, 80% of people who get in car accidents might have showered that morning, but the shower didn't necessarily cause the car accident.
That's why I don't shower.
Excellent reasoning. I can totally get on board.
To avoid car accidents.
From a medical standpoint, that is a good decision.
Right?
That is what we call a joke.
Yes, you can still sit next to me if we're in line together, people. I promise you, I shower regularly.
So what are some of the confounding factors here?
So great question. So think about it. Why do people take acetaminophen during pregnancy? Usually because they have a fever, an infection, pain, or some type of inflammation. And we know that maternal fever and maternal infections during pregnancy are also associated with autism risk.
So it might not be the Tylenol at all. It might be the underlying reason for taking it.
Exactly. Or it could be both or neither. And there's another layer. Some research suggests that people with certain genetic variations might metabolize acetaminophen differently, which could theoretically affect neurodevelopment. But this part is still really early research.
And actually, there was a really important study that just came out in JAMA last year that I think helps clarify a lot of this confusion.
Oh, yes. So the Swedish study, that was huge. That was what, about 2.5 million kids?
Yes, nearly 2.5 million children, which is massive. And here's what really is clever about that particular study. They looked at siblings within the same family where the mom used acetaminophen in one pregnancy, but not another.
Right, which is a brilliant way to control for all of those family level factors that we normally can't measure, like genetics or socioeconomic status or general health habits and much more.
Exactly. So in the regular analysis, without the sibling comparison, they saw what previous studies have shown, a small increased risk. Kids exposed to acetaminophen during pregnancy had about a 5 to 7% higher risk of autism, ADHD, or intellectual disability.
Which maybe sounds scary, right, when you read the headline?
Absolutely. But then when they did the sibling comparison, controlling for all those shared family factors that are harder to measure, the association completely disappeared. No increased risk for autism, ADHD, or intellectual disability.
So what that tells us is that the small associations we've been seeing in the other studies are likely due to confounding factors, meaning it's likely not the acetaminophen itself, but other factors about the families or the mom who might have needed or used more acetaminophen.
Precisely. Like maybe parents with certain genetic variations are more likely to have pain conditions that require acetaminophen, and those same genetic variations are associated with neurodevelopmental conditions in their kids.
So this is such a good example of why the study design really matters. You can't just look at associations and assume causation.
Precisely. And this should be really reassuring for parents who used
Hmm.
acetaminophen during pregnancy and have been worried about it. But okay, so playing devil's advocate here, should we just tell pregnant women to avoid acetaminophen altogether just to be safe?
So here's where we get into the real world medicine piece. Fever during pregnancy, especially in the first trimester, is actually clearly linked to neural tube defects and other developmental issues. We have strong evidence for that.
So treating a fever, therefore, is important.
Treating a fever during pregnancy is really important. And right now, acetaminophen is considered the safest option during pregnancy. Medicines called NSAIDs, nonsteroidal anti-inflammatory drugs, like ibuprofen, are definitely not recommended, especially in the third trimester.
So we're in this position where we have some observational studies suggesting possible risk, but we have clearer evidence that untreated fever is risky, and acetaminophen is our best tool for that.
Precisely. And I'll be really honest with you, I took acetaminophen at some point during all three of my pregnancies. I had pneumonia during my first pregnancy, terrible hip pain and rib pain with my last pregnancy. Advanced maternal age, anyone? And so no one should sit there with 102 fever or squirming in pain because of a possible association.
Exactly, because suffering through 102-degree fever is also not great for the developing baby.
Exactly. So here is our practical advice for parents. If you're pregnant and you have a fever, especially if it's over 100.4, treat it. Use the lowest effective dose of acetaminophen for the shortest time necessary. If you have a mild headache and non-medication approaches like rest and hydration and cold compresses help, great. But if you need medication, don't torture yourself with guilt. Call your OB if you're not sure.
And for kids who are already born?
Same principle. If your kid has a 104-degree fever at 2 a.m. and that poor child is miserable, give them the Tylenol, please. We've all been there. We've all done it. The benefits of treating a significant fever and pain definitely outweigh this, theoretical risk from these studies.
Right, and I think the key word there is significant. We're not saying you need to treat every 99-degree temp or every minor bump and bruise.
Exactly, right. So use it judiciously, just as with any other medication, but don't panic about having used it during pregnancy or in your early childhood.
Right, and for parents who are really worried or who want to discuss alternatives, talk to your OB or to your pediatrician.
Absolutely. Okay, so should we move on to something a little more hopeful?
Yes, ma'am. Let's talk about leucovorin.
All right, so leucovorin, Lisa. I'm going to let you take the lead on this one because I think I still have some PTSD from our biochemistry classes. So you'll probably explain this better.
I don't know about that, but I'll try, okay? So leucovorin is essentially a form of folate or folic acid. And most people know folate as the vitamin that pregnant women take to prevent neural tube defects.
Right. It's an ingredient in those prenatal vitamins.
Exactly. Now, folate is crucial for brain function throughout life, not just during pregnancy. And here's where it gets interesting. There's a subset of children with autism, we think maybe 15 to 20%, who have something called cerebral folate deficiency.
Which means what exactly?
It means that they have low levels of folate specifically in the cerebrospinal fluid, which is the fluid around the brain and spinal cord, even if their blood folate levels are normal.
Oh, interesting. So it's not a general folate deficiency. It's specific to the central nervous system.
Exactly. And researchers have found that some of these kids have autoantibodies. Basically, their immune system is blocking folate from getting into the brain, no matter what their blood levels are. Other children might have issues with transporting or metabolizing folate.
So the folate can't get to where it needs to go.
Right. And when folate levels in the brain are low, that can affect neurotransmitter production, cell growth, all sorts of important processes.
Okay, so that's where leucovorin comes in.
Yes, because leucovorin is a form of folate that can cross the blood-brain barrier more effectively than regular folic acid. And there have been several studies, mostly small, but some pretty compelling, that show that high-dose leucovorin supplementation can improve symptoms in some children with autism.
And what kinds of improvements are we talking about?
Well, the studies have shown improvements in verbal communication, attention, and social interaction. Some kids who were minimally verbal, they started using more words. Some showed better eye contact and social engagement.
Well, it's pretty remarkable.
Yeah, it really is. But, and this is a big but, this doesn't work for everyone. It seems most effective for kids who actually have cerebral folate deficiency or those who have folate receptor autoantibodies.
So you can't just give it to every kid with autism and expect results.
Exactly. And there's a testing issue too, because testing for cerebral folate deficiency requires a spinal tap, which is an invasive procedure, and it's not something that we do lightly in kids.
Yeah, lumbar punctures are not fun for anyone involved.
Yes.
And even though we get trained in doing these lumbar punctures during med school and residency, most primary care pediatricians or developmental pediatricians aren't doing them in the office.
Yes. I mean, most of us were trained on doing lumbar punctures in residency. You know, most of us on adults, you guys in pediatrics were trained on children. It is, Lonre is right. It is not fun for anybody.
It is not fun. Not fun for like the doctor, the person holding the poor child, and definitely
people
not
in the
fun
hallway.
for the child, right?
Yeah, we really, really have to be careful when we're choosing who we do lumbar punctures on, although they are life-saving procedures.
Exactly.
So some doctors are testing for the folate receptor autoantibodies in blood, which is less invasive than an LP, but that test isn't perfect either for a number of reasons, including the fact that it's actually not confirmed in research that the autoantibodies are the cause of having low folate in the brain, and also the accuracy of the antibody testing itself is still under review.
Okay, so where does that leave parents who are hearing about all of this and thinking, could this help my child?
Well, it's worth having a conversation with your child's neurologist or developmental pediatrician because they can assess whether your child might be a candidate for this treatment, discuss the available testing options, and talk about the risks and benefits.
Okay, and Lise, from a practical standpoint, is any of this covered by insurance? Because we know that's often a huge barrier.
Yeah, that's a great question. Very important, and it's complicated. Because leucovorin is FDA approved, but it's not specifically approved for autism. It's typically used for other conditions. So when it's prescribed off-label for autism, coverage can be hit or miss.
Which is frustrating for a lot of parents.
Very, very. Some insurers will cover it if there's documentation of cerebral folate deficiency or if it's prescribed by a specialist. Others will deny it and families have to appeal. And out-of-pocket leucovorin can be expensive.
Okay, so this is one of those situations where if you're in the US, you might need to be prepared to fight with the insurance company.
Unfortunately, yes. But if there's clear evidence that your child has cerebral folate deficiency, you do have a stronger case for coverage.
Got it. And in terms of safety, what do we know?
Well, leucovorin is generally well tolerated. It's been used for decades for other conditions. We first learned about it in medical school as a medication that was given to people going through chemotherapy to help protect healthy cells from the effects of chemo.
Yep, and it's good to know that serious side effects from leucovorin have been really rare in research.
Right. But of course, any treatment should be supervised by a doctor who can monitor for side effects and adjust dosing as needed. And overuse in our society could cause drug shortages, which is important to keep in mind.
Absolutely. So don't just order this stuff online and start giving it to your kid, please.
Oh my gosh, yes, please don't do that. Because along with everything else, you could trigger a whole set of new problems when you have no way of knowing what's actually in those pills showing up in the mail.
Okay, so let's wrap up with some key takeaways. So first, on the acetaminophen front, the research shows associations, but not definitive causation. If you need to treat a fever or significant pain during pregnancy or in your child, acetaminophen is still considered safe and appropriate. Use the lowest effective dose for the shortest time needed, but don't panic about having used it, please.
And second, on leucovorin, this is an exciting area of research that's showing real promise for a subset of children with autism, particularly those with antibodies against the folate receptor. So if you're interested in exploring this, talk to your child's specialist.
And I just want to say, if your child has autism or if you're in the process of getting evaluations and diagnoses, please know that the research is advancing. We're learning more every year about the biology of autism, about interventions that can help, and how to best support these kids and you as their parents.
Right, and every child is so unique. What works for one child might not work for another, and that's okay. The goal is to find what helps your specific child thrive.
Yes, and speaking of resources, we're going to put some links in our show notes.
Right, and we're going to include information on autism, resources for families looking for support and information, and some of the key research studies that we discussed today for anyone who wants to dive deeper.
All right, everyone. Thanks for listening. Take care of yourselves and your families. And remember, you're doing a great job, even if your kids think that your outfits are cringe.
Just remember, we don't. We love your outfits just the way they are. Take that, Gen Alpha.
So that's our show for today. Thank you, as always, for listening and for all your support. Hit us up on social media. You can follow us on Facebook, Instagram, and other major social media platforms. And subscribe and review us on Apple Podcasts, because reviewing helps other people like you find the show. And if you'd like to support us with a monthly donation, just go to our website at hippocratichost.com and click on the Become a Friend of the Show button. We'd be forever grateful.
Thanks, everyone, and talk to you soon.
Thanks for listening to Health at Home with the Hippocratic Hosts. Remember that all views expressed here are our own, not our employers, and all content is for informational purposes only and should not be construed as medical advice, nor the establishment of a doctor-patient relationship. Always consult your own physician or healthcare team for any medical issues.
If you enjoyed this episode, please rate us, subscribe, and tell a friend. And check out our website at www.hippocratichosts.com for show notes on this and all our episodes. Can't wait to chat with you next time.